and again, and better long-term outcomes are seen with the CGM. And there's something which is called real-time CGM, where you can track the glucose in real time. You don't have to scan the sugars again and again, so you can update every 3 to 5 minutes. You get a trend analysis of the glucose events which are happening, so you can analyze the trends and actually help the patient better to control the glucose. Maybe sometimes you have even seen that you can reduce the medications, sometimes stop the medications if they are doing well with their lifestyles. Customized alerts and alarms you will get, and easy to calibrate. You don't have to calibrate. It's a factory calibrated sensor and quite accurate nowadays. So accuracy is measured. If you see the blood glucose monitors, we know there are ISO standards. FDA has mandated that you should be passing certain kind of standards to be released in the market. And so for the CGM, you have a MARD, which is an indicator or which is used to assess the device. And MARD is a mean amplitude of relative differences between the glucoses. And this is the points which are very important. They are very rigorous testing and indicators which is used by FDA. I will not dwell into the details, but I'll tell you there are 3 tier requirements mandated by FDA to assess the device and pass the device. So this is the requirements. For less than 70, you should have at least more than 85% blood glucose reading within the range of plus and minus 15, 70 to 180, more than 70% within plus minus 15%, and more than 180 plus minus 15%. So these are some standard requirements. Of course, then you have requirement 2 also. So these are the technical details, and FDA uses these details to actually assess the device and give the recommendation on the said device. We know about the blood glucose monitors. We know about the flash glucose monitors as well, because we have to have a scanner. You have to scan every time when you want to have the blood glucose reading flashed on the mobile. With the CGM or real-time CGMs, you don't have to do that. And of course, a lot of things are much better in terms of CGM, because you can see the analysis and trends in a real time and automatically tracks the entire glucose patterns without any doing much of it. If you don't track with a flash glucose monitor, you will not get the data. The data will be broken. But with CGM, the data is not broken. It is continuous linear data which you will get. So this is the benefit of CGM as compared to the other 2 parameters, other 2 devices which we are using. There are 2 types of real-time CGMs currently available in India. One is Freestyle Libre Generation 2 and now 3. But it's still not a real time, because you have to scan before you start. You must have seen, you have to scan it. And then you will have to scan in between also, because sometimes the Bluetooth connectivity and the signal loss is there. So if you have used that, then you will see you have to come back again and scan it so that the data is continuous. But the i3 CGM sensor, the first sensor, which was 15-day wear, Abbott brought it out later, 15 days. Initially it was 14 days. 15 days wearable device, 3-minute readings you will get with high accuracy of MARD of 8.7%. Industry standard, you should have MARD of 15%. It is 11%, is sometimes nowadays become rigorous, 11%. So 8.7% is very, very good MARD in these sensors. Dexcom, not available currently. ADA has published a guideline. So if you are using the CGM, all the data which you collect has to be in the form of ambulatory glucose profile, which is a pictorial representation of all the data. Which in a one glance, you can see all the data, and time in range is accepted metrics now as per the world bodies. And you can see this is how you get the report. I'll dwell into the details of it. You can see there are time in range between 70 to 180. It should be around 70% and more. More than 80 to 250 should be around less than 25%. Time above range, which is, and less than 5% above 180 to 250. And time below range also 4% and 1%, the lower ranges. So you have to look into the ranges very importantly and accept the reading should be in these ranges if you want to accept the glucose readings. That is very important. GMI is a indicator which is as equivalent to HbA1c. So glucose management indicator is give you a complete summary of all glucose control throughout a defined period. And if you extrapolate this number and the patient follows the same behavior and exercise, you can say it is a 3 monthly HbA1c. You can equate to 3 month HbA1c. So this is the useful tool, and this is how it looks like. If you see a report, you have to first see the usage of the sensor, the date, how many days the sensor has been active, what is the CGM activity percentage, and then you look at the entire report. Time in range, time below range, and time above range. Look at the average glucose, look at the GMI, and look at the glucose variability. 36% is what is defined as to be less than 36% normal, and this is 7.9% you can see here. So this is the how you see the reports. And if you want to see the entire report, you can see the AGP report, then you can see the profile, and then day-to-day profile you can see in one single page. And you can evaluate the entire data in six steps. Look at the data adequacy, look at the average indicators. Then first you evaluate the hypoglycemia. That is a rule of thumb. You have to correct that first and then go to the hyperglycemic events. If you want to adjust the medications, look at the 25th and 75th percentile bar. That is affected by medications. And the patient's behavior is affects the 5th and 95th percentile bar. That will be affected by patient's behavior. So depending on which bar is wider, you can understand what has to be done next. And the patient engagement is very important in his entire process. You have to keep communicating and counseling the patients. Now, time in range is a now concept which everybody knows it. It's the amount of time you spend in a target glucose, which is defined as 70 to 180, and for most people, and it is around 17 hours of 24 hours total. So 17 hours of your entire total time in a day you should be spending in this range, and that will be equivalent to 7% HbA1c, which we say. Guidelines are very clear. Time range is a core metric now, which is accepted for blood glucose control in patients with diabetes, and all the guidelines, maybe ADA, ESG guidelines, ACE guidelines, everybody has accepted this as a core matrix. But what are the benefits? Do you have any benefits in using the real-time CGM? Yes, you can see type 1 diabetes, very good. RT-CGM versus the intermittently scanned CGM, difference in the HbA1c control, latest publications from this journal. Then you can see type 2 diabetes, patients with insulin therapy, benefits. The RT-CGM is more favored for hyperglycemia and time in range, and just near for hypoglycemia, just affecting maybe a little better than only the SMBG. So you can see the RT-CGM is really useful in both the types of patient, type 1 and type 2 diabetes patients. And if you look at the patients who have got pregnancy and diabetes, type 1 diabetes and pregnancy, data is very clear that has got a much better A1C control, 0.2%, but translated into better outcomes in terms of low for gestational age and neonatal hypoglycemia requiring IV dextrose and NICU admissions. So was much lesser when the patients were using RT-CGM. This is a concept study which I was speaking about, a very nice study. And then you have a gestational diabetes in pregnancy. The gestational diabetes, meta-analysis very clear. It is also shown to reduce the gestational weight gain and lower infant birth weight. So in both the situations, type 1 diabetes and pregnancy and gestational diabetes, it helps. And more support for CGM and our pregnancy is now a point of discussion whether you should use RT-CGM or not in pregnancy. We have a lot of real world data showing that you can use the RT-CGM in pregnancy. So clearly there are benefits in all types of patients. This is a newer sensor which we have, ICANN i3 sensor, third generation sensor, and you can see there's a sensor pack, a transmitter, and a health app which is there on the mobile, and you can put it on the abdomen, and now it has been approved also to be inserted on the upper arm. And MAR accuracy, you can see closest which comes is the Abbott Freestyle Libre, but this is also not far, 8.71. So it's a very good mark, showing is very accurate as well. And the third generation sensor uses direct electron transfer, right? And uses a different set of enzyme, glucose dehydrogenase. So the interference with acetamide, paracetamol or ascorbic acid is much lesser. What we used to see with earlier sensors and glucose monitors, now you don't see much of a interference with this in this kind of a sensor, third generation sensor. So you can see this is can be used in 2-year-old for 15 days, and it's a real-time Bluetooth. You have connectivity, no calibration is required. 18 months this sensor can remain. And 120 minutes is the time of initialization. MARD value is 8.1%. You can have a data receiving device from iOS, Android, Google Play app, and output frequency of 3 minutes. Every 3 minutes you get the data. So this is in one glance about this sensor, and no interference from vitamin C or acetaminophen has been seen, right? So, but you have to have some software to interpret the data and generate the report. So you have IGM Health, I Can Reach, and I Can Review. This is a doctor platform. Then patient health platform is I Can CGM or Health app. So this you can use it for the patient, and there's a partner app also, I Can Reach, which the patient's caregiver can use. I just go into the details of I Can Health. This is the patient app. You can see here arrows. You can see the Bluetooth connection. You can see the trend arrows, how the sugar is trending. Then you can see the landscape and glucose graph, and high and low glucose alerts also there. You can add a note of what you are doing, exercising, eating what, everything can be added during that time. Landscape view, you can see the glucose in 24 hours, daily average glucose, glucose trends, all things can be seen with this, with the app that the patient is using. And you can add, they can add their events also, right? Then you can have glucose reports, they can generate the reports, they can also export the reports and can send it to the caregiver for the further evaluation and if there are any changes to be done. There are customized alerts, you can keep the alerts on vibration or sound mode. Maybe you can decide what level you want to take the alerts, 220, 70. So patients can have their own alerts customized and they can keep the alerts in the way they want. Either they can silence them or they can put it only on the vibration mode. They can also share the data with the doctors, and the doctor's side of the app is called the I Can Review, which is the healthcare service management system. And you can see this is a very important system which is assists the doctors in viewing, analyzing and evaluating patient glucose data for more effective diabetes management. And you can see this is my workbench. This is my patients who are already on the sensors, and you can see with one glance I can see how the sugars is being tracked for all the patients, and I can immediately click and find out who is doing what. And this is at glance data facility which is not there in any other software. You can just with a glance you can see what is the time and range, how many hypoglycemic events. So if you want to see somebody's hypoglycemic events, you can directly go there and check what's happening with that kind of a patient, and you can immediately call them and understand what was going wrong. This is a daily glucose report, data analysis indicators, glucose level records, and see the events have been recorded by the patient, what she has eaten. Can I have the pointers here? I can, yeah. Here, this is the point. This you can see here. Whatever has been eaten, whatever events have been recorded, has been entered by the patient. So you can get it directly see everything at one glance in this daily analysis, daily glucose report. And ambulatory glucose profile, overview, everything you can see, high glucose conditions, multiple daily glucose details, post-meal, a lot of data you can see. You can customize how you want to do it. And this is a AGP report which you can see, time in range, time above range, and the glucose profile day to day, everything can be seen in one glance here. That's no problem. And this is a typical AG report which is generated here. You can see that 50th percentile, 25th to 75 percentile bars, and 5% to 95 percentile bars, and accordingly you can judge what is happening and what is mainly deciding the variability and instability of the glucose, and then accordingly you can counsel the patients, and you can see data reports. So there's a lot of things you can do. Everything at one glance you can see, time above range, and then you can see the glucose management indicator. In one page you can see all the data at a glance. This is the facility which they give. So and also export the data for your research purpose and whatever you want to do. So take home messages: RT-CGM is transformative in diabetes care. Clinical evidence supports use across type 1, type 2 and pregnancy as well. Behavioral changes also we have seen. Also the data is still lacking, but people are saying that behavioral changes are profound and lasting. Recent paper which I read was showing that CGM, till you are using CGM, the behavioral changes remains. Post that probably the behavioral changes are not that way, very consolidated. So we still have to wait for that. Technology keeps improving and adoption must follow. training and access are critical care for the success. That's very important that you keep talking to the patient and keeping training yourself about these conditions. And now I invite you for our third IMPA conclave. Can this play? I think it is not playing. So we have an IMPA conclave. This is the International Metabolic Physicians Association. We are having a conclave in the next year, 28th February and 1st March in the Hotel Lalit Ballroom. And you're all invited there. Thank you so much.